Hi, and welcome to topic 3 in your public health unit. So this week we're going to introduce you to the concept of burden of disease. It's an important one for you guys to grasp because it has a huge impact on where we delegate our health funding, our resources, where we look at our workforce in accordance with where we can see the most needs are. And I said burden of disease is a different type of calculation to help us beyond just the morbidity and mortality rates that we would normally look at to see whereabouts are the most areas of need. We want you again to just revisit the definition of chronic disease, and we're going to introduce you to the National Strategic Framework for Chronic Conditions and have a look at a few other Australian health policy developments and so forth to address the burden of disease or chronic disease in Australia. Part of this unit, we're also put in an activity where we're asking you to explore a few different health organisations out there. And this is for you as both health professionals to use for areas where you can go to seek further information or professional development, but also resources then that you can know you've got access to if you need to refer your clients or patients to those. We've also included the Rheumatic Heart Disease Australia modules. The health worker module is the one we're asking you to do. It does contribute a certificate to your professional development, so it is well worth completing. And we do take questions straight off this education module for both the quiz and the exam. At this stage, as we're in topic 3, we're also in week 3. So this is a point for you to start thinking about how you're going with the unit and your other units of study as well in the course. Census date's just around the corner, so you might be at that point where you might need to rethink your unit enrolment and so forth. So use that census date, and now's the time if you're thinking that you can't continue with the unit to withdraw from those. If you've got any questions at all or need some advice about unit enrolments and so forth, just make sure you contact your unit coordinator or your course coordinator. Okay, so I hope you enjoy this topic.